Hello and welcome to everybody joining us today for our very special ISNTD Connect session. We've passed the year mark now with the Connect series. We started right at the beginning of March. We've had a lot of different topics. One of our primary or kind of principal themes for this year, really, we're trying to really look at access and everything associated with access. One of the kind of areas that we really wanted to kind of focus in on and really kind of this kind of came together for this particular webinar was really the whole concept, the imagining, reimagining, redefining the supply chain within NTDs and global health. Efficient, effective, these are the words that get bandied around when it comes to supply chain management. It's a critical role. It has an absolute and critical role in terms of making sure that essential medicines, diagnostics, vaccines for NTDs, for global health in the wider sense, actually end up reaching those affected communities. Most of these supply chains that we're talking about in this context are set against quite resource poor backdrops. And what this panel, we've set a fantastic, honored to have a fantastic panel here. And we're really going to have a look at trying to unpack and explore the relationship between the WHO's shifts in NTD for their guidelines, for their guideline report, and also the SDG, the Sustainable Development Goals, and have a look at the effect of COVIDization in this area in one way or another. But that's kind of the gist of this particular panel. So we have with us Didier Diane, the Senior Director for Global Advanced Planning at it's the Center of Expertise, Supply Network Operations, Global Healthcare Operations at Merck. Hi there, Didier.
Hello, everyone.
Hi there. And I think Didier's going to speak about sustainable supply chains. We have Elizabeth Amuli joining us from Dar es Salaam in Tanzania. She's the program specialist for Tanzania for Business for Health Solutions, and we'll be looking at increasing healthcare access in Africa by building local private sector supply chain. Hi there, Elizabeth.
Hello, Cameron.
Hello there. And Pauline Potter, for the Senior Supply Chain and Sustainability Expert at Officio Consulting, who's joining us here from London, looking at delivering sustainability ambitions through procurement. Hi there, Pauline.
Okay.
And joining us from Copenhagen, UNICEF's Senior Advisor for Immunization and the Team Lead for Immunization Supply Chain, Michelle Seidel. Hi there, Michelle.
Yeah, hi, everyone.
Okay, so I think thank you very much and a round of applause for making time to be in part of this panel. I think we're going to take a deep dive and kind of, without further ado, get the session started. And the first speaker that we have, I'm going to hand over the floor to Didier Diane. I think, Didier, you're going to be speaking about sustainable supply chains. So I think I'll ask the other speakers to, if you don't mind, if you could just mute yourselves and just put your video off while Didier takes the floor, and I'll bring you in. I'll bring the second speaker in after. Thank you. And over to you, Didier. Thank you.
Hello again, and thank you very much for the invitation. And I'm very pleased to be with you today, having the opportunity also to give you some insight about what we mean about sustainable supply chain at Merck. First of all, let's just have a review about who we are at Merck. So Merck can be considered as the oldest pharmaceutical company in the world because we have just celebrated the 350th birth anniversary a few years ago. So everything started in 1668, and now we are a team of 58,000 employees located in 66 countries that make a positive difference to millions of people. So we are known as Merck everywhere in the world, except in the US and in Canada, where we operate under the name of our divisions. Talking about our divisions, we have three divisions. I'm part of the first one, the healthcare, where we really put the patients at the center of our work. We have different business franchises, as you can see here on the slides. And we have also a significant number of our products from our portfolio that is part of the essential medicine list from the WHO. Our second division is the life science. On these divisions, we provide R&D as well as biotech production equipment in the frame of genome editing, but also in food and beverage testing and in biologics. And our third division is the electronics, where we provide and enable smart technologies with our sensors, but also we have the displays with OLED and LED, and we also have pigments for different use cases. Now, talking about sustainable supply chain, and especially in low and middle-income countries, we are all aware that the supply chain there is very complex because there are a lot of different stakeholders, starting from the private sector, but also the public sector and the NGOs. And we also have a lot of different layers up to the time the patient can get their medicine. So globally, we know that there are 2 billion people worldwide that do not have access to medicine. And 1/2 of them are not having access to their medicine just because they are far away from a doctor or a clinic. And unfortunately, the population in the low and middle-income countries are the ones that are the most affected by this fact. So we definitely have huge gaps that remain, and we need absolutely to establish a robust supply chain so that we can ensure that the delivery can take place safely in a most effective way and also on a continuous basis. From our side at Merck, we work to addressing this supply chain barrier, starting from the first mile, but also up to the last mile, so that we can really deliver high quality medicine to the patients, and especially in the remote locations. Now, access to health is definitely a big challenge in the developing countries and all along the product life cycle. Already before the market approval, talking about registration, it's very important that we can have a good view on what are the market needs, and also having the possibility to assess what are the prevalence, the diagnosis, as well as the treatment rates of the medicine and the disease, so that we can definitely put the emphasis where we can bring most of the value. But then talking about the first mile challenges, there are all the challenges that are related to manufacturing, to storage and distribution, up to the time the goods reaches the market. And on that side, there are a lot of challenges. And I just mentioned a few examples on the left side, starting with the forecasting. Because definitely having the possibility to forecast accurately is a challenge. And having a bad forecast can definitely lead to suboptimal distribution. So we have to take that into consideration. Then we have all the quality and safety aspects. It's very important that the good manufacturing practices, as well as good distribution practices also, are the standard in the way we are doing the business. At Merck, we have only one quality system. So that means that we ensure that everybody gets the same quality, whatever the manufacturing sites and whatever the markets we deliver our product to, being either a mature market or a low and middle-income countries. And we ensure that these standards are valid not only internally to our entities, but also to our external partners, like our contract manufacturing organizations, for instance. Then the third challenge, if we talk about the first mile as an example, is definitely the custom. We know that there are a lot of country-specific procedures that can delay the supply of drugs. So this is definitely a challenge that we see in the first mile. Now, after the first mile, we have the last mile challenges. And these ones are more the ones related to the distribution to the patients in the market, and especially for the patients who are in isolation. As I said before, we have almost 1 billion of people who cannot have access just because they are not close to a doctor. So on our side at Merck, we try to localize as much as we can the production as well as the distribution, so that not only we can speed up the delivery process, but also minimize the related costs. Another element in the last mile challenge is the distribution, and especially for the cold chain product, because this one needs to be kept under temperature and humidity controlled conditions. And we all know that in low and middle-income countries, and in many of them, we have high temperature. So this is a challenge. Another important one in the last mile is the counterfeiting. And we all know also that most of the counterfeiting takes place in the low and middle-income countries. So it's really important that we can fight against these counterfeit drugs And on our side, we have a lot of track and trace initiatives. We have implemented a global batch traceability so that we can ensure that if once we have a problem with one of our batch, we can run effective recalls also in the low and middle income countries. And finally, talking about the challenges in the low and middle income countries, we also have the capacity building, that's also called the second mile challenges. And this one takes place all along the product life cycle. This is related to the training of the health stakeholders. How can we ensure that the health stakeholders are competent and skilled for the task that they have to accomplish? And to support that, we need to work in partnership, collaborating not only across the industries, but also across the sectors, if we want to really strengthen the whole health ecosystem. Now at Merck, we really want to create a shared value, not only for our own company, but also for the society as a whole. Of course, we are a pharma business, so we need to generate returns for our shareholders, but we also and especially want that our investments reach the underserved population through our sustainable business models. At the same time, from a social value standpoint, it's very important that our solutions can be innovative enough so that they can address the unmet medical needs in the developing world, so that at the end, the people's lives can be improved, not only from a health perspective, but also from an education and income point of view. And all that together brings this shared value where we can really generate a positive societal impact that creates new business opportunities, but also improve people's lives. But to do so, we cannot do that by ourselves alone. So that's why it's important that we can partner with other entities so that we can really amplify the impact and really shape the progress of the Sustainable Development Goals. We have just mentioned on the right side some example of the United Sustainable Development Goals that we think we can impact directly with our initiative that we have at Merck. Now, talking about capacity building, we have launched an access mentoring program in collaboration with BHS. So BHS being the Business for Health Solutions. So this is the non-profit organization which has the mission to increase the health access, especially in the communities in Africa. And you will hear about BHS much more in a few seconds because Elizabeth is going to talk about it. On our side at Merck, we have created a pool of 27 Merck supply chain and quality experts who volunteer to help and to contribute with a mentee company, being either a local distributor or a hospital in Africa. So we did our pilot, for instance, with the Tanzanian distributors. And that can take place on any aspect of the supply chain topics, being either demand or supply planning, but that could also be on customer service and order management or procurement. We also had a topic on warehouse and distribution, sometimes on quality and even on importation. So any aspect for which the mentee needs help, then we try to provide our expertise. So BHS connects the Merck expert with the local health company, and then we can engage together through a remote skill building. So together we define some objectives based on the business needs, and then we launch a project that lasts between 3 to 6 months, depending on the number of topics that we want to tackle. And what is really important is that at the end, we really measure the results, because we have seen during the last 2 years when we run our specific project that at the end, the mentee company could get a lot of benefits that were very tangible. For instance, we could see that we could improve the service level a lot, that the procurement lead time could be reduced, that the inventory level could also be managed properly, and so on and so on. So many concrete benefits that could be reached. So of course, we will look at it in much more detail now with BHS speech, and I give now the words to you, Elizabeth.
So thank you very, very much for that, Didier. Very energizing, not just in terms of the overview of the first, second, last mile brackets and the kind of view that you have on supply chain, but energizing because of this access mentorship program. It's so exciting, and I'm sure a lot of people in the audience are going to be reaching back to BHS, as you said, that they're connecting to Merck through that the non-profit activities that they're involved in. Before we hand over to Elizabeth to kind of open that up, I just wanted to put a bit of a shout out in terms of the audience. We're glad to see quite a good country kind of spread from ranging from Merck itself, from Beatrice Greco, head of the R&D programs there, Claudius Chekalupo, Maximilian Godwin, head of the Southern African Developmental Community, the 16 youth parliaments of 16 African countries. Max is the head of the NTD's task force. He's joining us from Tanzania. We're getting a shout out from quite a few people. Lisa O'Halloran from the London office of Officio, Mekalina Isai from Tanzania. Hello there. Jennifer Giovanoli from Switzerland. We have from Nairobi, Kenya, Abdul Razak Hudo. Stephen Bramia is joining us from Canada. We've got Ezra Jerome from UNICEF office in New York. Carolina Batista from Brazil. We've got Uganda. We have Albania, Kampala, Uganda, Madagascar. Quite a nice spread building up there. A lot of interest in this topic, and I'm pretty sure a lot of interest in our next speakers kind of opening up of the Access mentorship program that Didier's just kindly mentioned. So I'd like to give a round of applause and bring to the floor Elizabeth Amuli, the program specialist for Tanzania for Business for Health Solutions. I was going to be talking about increasing healthcare access in Africa by building local private sector supply chain. So Elizabeth, if I could ask you to come over, and I'll back out. Thanks a lot, and over to you.
Thank you, Cameron. I will walk you through how Business for Health Solutions increases healthcare access in Africa by building local private sector supply chain. I'll talk a little bit more about our collaboration with Merck. So who we are basically has been mentioned a bit before. We seek to develop a sustainable African healthcare industry. We focus on improving quality, affordability, and accessibility to healthcare products and services to our patients and their communities. We do this by strengthening the local private sector supply chain. This is all done remotely, facilitating through technical assistance projects using highly skilled corporate volunteers. And our projects really seek to touch base on key SDGs as mentioned prior by Didier. We look at the good health and well-being. Overall, we touch on decent work and economic growth. We look at industry, innovation, and infrastructure through the projects, and through our partnerships, we seek to find common goals moving forward. How we come about is we look at the private sector itself, and we know that a lot of the public health sector is the one which gets the majority of initiatives locally in Africa, and so we want to see to bridge the gap on the neglect in the private sector. Together, we identify the gaps with enterprises that are private. We seek to see areas where there's capacity constraints, and we see how we can address this remotely using the BHS model that I will talk about a little bit more forward. All this is demand driven, and the healthcare enterprises are the ones who specify their needs. And these needs are also brought forth to the corporate experts. And through their virtual skills-based volunteering, we support the management of the projects, and we measure the impact using our models. Of course, we have various areas in the healthcare value chain, and we seek to create impact wherever we can. Looking at production, distribution, this is a great area that we've worked closely together with Merck. We also look into service providers. We seek to look at other payees, intermediary projects, but overall seeking to improve points at the healthcare value chain. How we work, we'll talk a little bit about our project cycle. We look at 4 areas. That is, we seek to connect. That is, we identify the local enterprise. We identify their needs together with them. We then match them with the right volunteer, with their expert skills, and we seek to scope a project together. And we supply a way of facilitating the project goals, identifying the timelines, what would be our success metrics once the project begins and ends, and also at the end of the day, see how we can connect and create a channel of success by measuring the impact that we've created from the beginning to the end of our project. So this is our general life cycle for our model. So how do we create value? We create value through 4 main pillars. The VHS clients themselves get to have capacity building through their employees gaining skills. We manage to solve business challenges together, and we support their business growth. For the volunteers, they gain skills and competencies by engaging in projects that are different from what they might be doing on a day-to-day. They also may end up having personal satisfaction just through the volunteer experience itself. Looking at the corporate partners, they often seek to see their employees engaged in activities that are broadening their perspectives, that can bring now even a fresher input into the work that they bring into the corporate world. And also we have look at the management process. I mean, the volunteers end up managing projects that are a wider base, and you get to have an insight into the African market share. In our communities, we end up having increased healthcare access, which at the end of the day is our goal, and that is where we want to go. So looking at our framework, how we look at impact and how we seek to achieve it, we begin with activities themselves. As we mentioned prior, these are all technical assistance projects. We are connecting with the industry experts and the healthcare experts, and we address the deep technical business needs. We look at the outputs. We see, have we increased or created an improvement in the product or services being provided by the client? We also acknowledge staff being supported through increase in knowledge and skills. Then we look at the outcome. How many individuals have increased access or have had their improvement in products and services? We then overall now seek, with evidence, scientific evidence, the reduced morbidity or mortality in key demographics. Some of the areas that we've focused on from our pilot and initial projects include newborn, child, adolescent, mothers, and adults, and non-communicable disease focus. Talking a little bit about our partnership with Merck, Didier has touched on a bit on the different projects that we've worked on, but overall, we've worked with 27 experts in the last 1.5 years through the supply chain. And we've had investment of over 250 hours through the remote assistance support. We've had 7 projects which have either been completed or are still in progress, and we've supported 6 enterprises to improve their operations. I'll talk a little bit more about one particular one. And we have been working closely with Merck in 2 countries of Tanzania and Ghana. Our supply chain focus has been in 3 areas of inventory management, where we've been optimizing stock levels, looking at how we can improve delivery times and reduce the stockouts, and also look at how we can reduce product expiration. We also have been looking in the area of procurement practices and vendor management, that is improving timelessness and quality of the supply. And also we've been looking at the 3rd area of demand planning and forecasting, where we've looked at clients or worked with clients who are focused on as distributors, local drug manufacturers, and also as hospitals. Our impact, after looking at the market share from the clients that we've worked with, has improved healthcare access for over 1 million people based on our estimates. And this includes looking at the areas of increased availability for the essential medicines for key burdens of diseases, such as pneumonia and malaria. So I'll go into focus with one particular project that we've been working on for 9 months, which has contributed close to half of the technical hours assistance mentioned prior. This is with a Tanzanian distributor who is locally owned and has a wide market share in the country. They are requested for assistance around inventory management processes. What we did is connect them with 4 supply chain experts from Merck, and we supported them through 28 remote connections over a 9-month period, where they contributed 130 hours of technical assistance. The areas that they supported improvement in was, as mentioned prior with Didier as well, areas in forecasting tools, improving the accuracy of a product-specific demand for demand planning. And also we've looked at improvement in their inventory management processes. We supported them in modifying their methods for product costing And we also assisted them to improve in their planning for their automated consignment and inventory monitoring, which they will soon initiate. So at the end of this project, we have results that were measurable. What we noticed was that we have created a reduction of 40% in the delivery time. And we have also created an increase in quality of purchase by 36%. Starting with a baseline of 90%, inventory accuracy has improved to 98%. And we have created 0 product expiration in the stock and expiry dates. So overall, BHS will continue to serve through collaborations such as Merck, with the one we have with Merck. And we are creating impact slowly through the projects that we conduct. And through this forum, we hope that we can create even more awareness about the opportunities that we have in creating impact by using virtual modalities, and how we can really link with the world and bring the global aspect even closer to home. So briefly, I would like to end here, Cameron, and welcome you back. Thank you very much.
Thank you very much, Elizabeth, for a fantastic presentation. A lot of comments coming up in the box as well. I would absolutely love the impact framework, and I'm sure that's going to have a lot of questions, catalyze a lot of questions in the Q&A. It speaks volumes, I think, to a lot of the policy frameworks around supply chain. I think we can explore that in the Q&A. Wonderful presentation. Thank you very, very much for that. And I think that we'll move to the next. That kind of brings us into the next presenter, the third presentation for the day. Pauline Potter, the Senior Supply Chain and Sustainability Expert at Officio Consulting, delivering sustainability ambitions through procurement. I suppose when you ask one person to the next person, the definitions of sustainability change. This will be interesting to kind of hear how that kind of looks through the eyes of Officio and their consulting effort in this presentation. So without further ado, I think it's a round of applause for Pauline and welcome you to the floor. I'll just back out over to you. Thanks a lot.
Yes, thank you, Cameron. Good afternoon, everyone. As Cameron mentioned, I'm Pauline Potter. I like to refer to myself as a specialist in procurement with a passion and a bit of education around sustainability. And I'd like to talk today about the role that procurement specifically can play as a function in helping deliver sustainability ambitions, regardless of geography, sector, industry, as well as highlight the importance of cross-industry and cross-geography learning in this space. There is so much going on and so much good practice that it's really important to kind of come out of the detail and look at what all of the other good things happening around the world are. Very brief overview on Officio Consulting. We are a global organization of procurement specialists working in a variety of industries, sectors, and geographies. Most relevant to this group here, we do actually a lot of work at the moment with the UK vaccine, PPE, and test and trace supply chain deployments. And really, we are a group of people who are fundamentally passionate about leveraging this core procurement skill set to drive a wide array of business ambitions. And when you think about the ambitions of a business and kind of the traditional role that procurement has played, particularly in the private sector, there's been a traditional role of focusing on objectives like cost reduction and cash flow improvements. It's really about kind of minimizing a single KPI. And one of the most exciting things about this most recent transition over the last really several years in particular is that we're looking to expand the strategic focus that sits within a procurement function from kind of cost and cash through to a wider array of strategic objectives like supply chain risks or growth enablement, and a wide array of sustainability. As you mentioned, Cameron, that can mean so many different things, from waste to carbon to diversity and inclusion to labor practices to circular economy to supply localization. And it's so important that procurement are actually quite well positioned within organizations and private and public sector to influence that. One of the reasons that that's true is, the way that organizations and businesses and governments spend their money is sending out a signal as to what they're willing to kind of put their ambitions behind. The procurement sitting as kind of the facilitation between the business and its supply chain is really the, ombudsman of that area. The other point is that a lot of your sustainability comes from the supply chain rather than an organization itself. So for example, when we think about carbon footprints, if I take the chemicals industry, about 75% is an industry average of their carbon footprint sits within the supply chain rather than in the industry itself. So that's really important for those who are empowered within the procurement function to actively look for opportunities to influence that. And while that's not new, sustainability has been a core focus and something that procurement has been asked to explore for quite some time now. I think the really exciting thing that we are seeing at the moment is that this pace of change is absolutely accelerating. For my own experience, absolutely over the last 18 months, I've seen a fundamental shift of internal and third-party pressure that are really focusing on how do we face these sustainability challenges head on and move beyond kind of lip service and sort of box ticking to actually making it happen. And I think the critical thing is to reflect in any purchase that a business, organization, government is making, reflecting those requirements. So procurement taking on board changing regulations around plastics or supply localization, having clear expectations in their supplier evaluation and selection process around things like social value or localization or diversity of that supply base. And consumers and customers are increasingly stating that it's non-optional to consider sustainability within a business's strategy. So all of that is bringing together, again, I think that procurement can really play this fundamental engine of change role. So if it's not being leveraged to do so yet, looking at stepping that up. What I see as well is, whilst a lot of businesses and organizations are taking very strong steps forward in this, there's a couple of very common things that I'm seeing as kind of slowing that acceleration. So I want to take a few minutes just to talk through those kind of challenges holding businesses back or perceived challenges. So the first is around sort of senior leadership buy-in. One of the common things that you get as a procurement professional is you're told that sustainability will cost more. And I think the natural thing that we all need to be prepared to go and defend is one, as in the fantastic examples that Elizabeth and Didier have just highlighted. In the case of effective demand management and improved planning, sustainability and cost can go hand in hand. And second, that there's more commercial opportunity than just cost as well, which is really important where funding is limited or you're seeking investment potential to be able to demonstrate that there is still commercial benefit, either around market access or margin improvements or just meeting the consumer's needs. The second is around establishing KPIs. This can feel quite daunting if you're new to the sustainability space, but again, the good news is there's actually a wealth of resources out there between the Sustainable Development Goals indicators. The Global Reporting Initiative has literally thousands of available metrics that you can use and apply to your organization, as well as very industry-specific initiatives that you can link back to. Third is around baselining and data collection. Again, I think it can feel quite daunting, but the key is not to eat the elephant in one bite. You want to take, what are my objectives? What information do I need to be able to make decisions in the right direction, and start collecting that internally, mandate it from your suppliers, or leverage third-party resources. 4 is where to get started. I think this perceived risk of not wanting to make the wrong move and then be accused of greenwashing. And I think a key theme here is really about education and training. There's so many facets to sustainability, so many different and fascinating topics, but actually they are quite accessible. And so kind of upskilling your internal organization, your procurement teams, and all of your stakeholders in those key areas is absolutely critical. And then finally, around available supply. And this is particularly applicable as we discussed today around developing economies where access and maturity of local supply markets aren't quite there. So when you think about that final challenge specifically, I wanted to talk through a bit of an example. So over the last 10 years especially, we've seen supply chains sort of lengthening and growing increasingly complex. And today's supply chains just are not going to be able to deliver this wide range of sustainability ambitions that globally we have for the future, linked to the Sustainable Development Goals, as well as local business and country ambitions. And localization, I believe, is going to play an increasingly important role for both private and public sector, not only for cost, but also kind of long-term economic sustainability, environmental sustainability, social improvement, and risk management. And procurement have a really significant responsibility in delivering these transformations, again, as the kind of intermediary between supply chain decisions that are being made, what suppliers we're working with, and how we're signaling to the world how we spend our money. So taking a bit of a step away from the focus here, I think that one of the greatest things that we can learn, and I'd like to highlight for the kind of final few minutes, is the opportunity to leverage kind of learning and knowledge sharing across industries for challenges that are common across them all. So in the Middle East and Africa, reshaping in-country supply chains has been a huge, huge focus over the last 5 to 10 years. So something that we do a lot of support and work in is around implementing procurement programs that are specifically enabled around developing what we call local content. So how do we focus on driving procurement decisions that are faced around more than just cost or the total value of the business? How do we broaden that definition of value? And that's given us a lot of opportunity to learn from some really great best practice and also some quite common challenges that we're seeing. But we've seen some really fantastic and sort of accelerated progress in this space as well. So there's a lot of learnings that, although it may not be directly related to your sector or to your geography, really we need to take that learning as an area that is particularly advanced in this space. So the key kind of takeaways that we found from that local content development work is first making sure that there is a really clear strategy. Now, that mandate can come from government. So in the case of, for example, Saudi Arabia, there's a very, very explicit requirement about the level of local content they're expecting private and public businesses to incorporate. It's very clear delineation of what we mean by local content. So is it just about labor? Is it about where goods and services are manufactured, their natural resources, but also things like training, capacity building, and the assets they're used in? So establishing that upfront, if there are ambitions to localize, kind of why, in what areas, over what time frame, and then being very clear with whoever is interfacing with that supply chain that that is the expectation. The second is around developing specific structured supplier development programs. So as many on this call will be familiar with today, when there are ambitions to localize supply, often it's not achievable to do that overnight with an existing supply base. So a really important area, as Elizabeth alluded to earlier, is upskilling your procurement and supply chain teams to help develop suppliers. And that can be through existing local suppliers who just need some support in terms of technical training, health and safety, perhaps financial backing, operational efficiency improvements to make them a viable supplier. It could be expanding the market and creating a need for foreign suppliers to come and establish a local presence. But no matter what that is, it's a really, really critical role. And again, looking through the kind of skill set of procurement, that supplier relationship management and performance management can come into a fantastic play here. The third is around developing strategic partnerships. Sustainability is one of the most exciting ways that we've seen a significant level of cross-industry, cross-sector collaboration, and developing those strategic alliances for increasing innovation and de-risking is really important. And then fourth is around measurement and tracking. And obviously, as a procurement focus myself, that's most effectively done for things like localization when you contrast it against your spending. So how do you understand the impact of where the money throughout your supply chain is being positioned? That closes off my section. I think a couple of takeaways to leave with the team here, and looking forward to the Q&A, is that supply chains absolutely need to evolve. That's true globally. That's true across every industry, every sector, every geography. And procurement has the opportunity to play a really fantastic role as an engine for change. So if that's not front of mind for your procurement teams yet, it really should be. The role of procurement is changing. It's important to step up into that strategic remit. I think that's a really exciting area that we should all be looking to upskill and train and look to apply, again, that structured foundation and skill set to a much wider strategic vision of delivering value rather than minimizing cost. Third is, there is some great progress being made, be it on local supply, diversity improvement mandates in the US, this focus on plastic and waste across Europe. It's increased International Labor Organization mandates around what fair labor truly means for businesses. It is so important, no matter what business or industry you're in, to learn from those success stories, and then proactively to collaborate across industries to make sure that you can accelerate any sustainability transformations. That brings me to a conclusion. Thank you very much. I think back to you, Cameron.
Thank you very, very much, Pauline, there. Wonderful presentation. What a profound point you made in terms of sustainability comes from the supply chain, and then that sustainability becomes the touchstone for further cross-sector partnerships. I think we're going to open that up in the Q&A as well. Great presentation. Thank you very, very much for that. A round of applause. That then now kind of neatly brings us into the final presentation. And I'd like to give the floor over, a round of applause, to Michelle Seidel, the Senior Advisor for Immunization, the Team Lead for Immunization Supply Chain at UNICEF, talking about supply chain strengthening and joining us from Copenhagen. So over to you, Michelle. Thank you, and I'll back out of here. Thanks a lot. Over to you.
Thank you very much, Cameron. So as Cameron said, I'm going to be speaking mostly about strengthening supply chains and our sustainability efforts closely linked to the SDGs. And I think we all recognize that from the transition from the NDGs to the SDGs, that the goals have shifted from survival to survival, health, and well-being. So we have developed a framework to address this. And in our sustainability strategy, it's based on 4 pillars. And that it is essentially to ensure that children are the focus of environmental strategies, to reduce emissions and pollution, empower children to be agents of change, and to protect children from impacts. But essentially, our response framework has been around 5 critical elements, and that is to strengthen climate resilience and environmental sustainability in healthcare facilities, develop a responsive primary healthcare, really to reach those underserved communities, embed environmental health in school programs, and then promote action and mobilize collective action as well, impacting a number of the SDGs. So drilling down into the focus areas where we're strengthening supply chains, we're looking at sustainable procurement and reducing carbon footprints, renewable energy sources, and responsible waste management. So I'm not going to delve too much into this. I think you've heard quite a bit about it already from previous speakers, but we do focus on planets, profits, and people. So essentially the economic angle, the social benefits, as well as the environmental. And part of our sustainable procurement measurements include all of those, as well as looking at where there are any general compacts that vendors are participating in, and where there are any verifications, etc. But I'm going to let the audience read this later. I'm not going to go into this into too much detail. I want to focus on some other things. So in terms of sustainable procurement, just a concrete example in terms of how we do this. So taking cold chain equipment, for example, and this has been a big focus with the rollout of COVID-19 vaccines. We reduce through the procurement of solar equipment and innovative technologies. We reduce carbon emissions and reduce waste. And these optimized technologies are obviously very energy efficient, but we also procure all our cold chain equipment is WHO pre-qualified, which means that the refrigerants are CFC free as well. On the economic side, we increase the value for money by ensuring that we look at the total cost of ownership, and we also look at the whole life cycle costing, so bundling the procurement of the equipment together with installation, deployment and installation of the equipment, and adding maintenance and training onto that as well. So this really affects and complements the social factor as well. So there's job creation and a supplier base expansion and a training element to it as well. So in terms of the renewable energy sources and why we're interested in this is really to extend the reach of our immunization program, and essentially through solar direct drives, but also electrification of health facilities and beyond in support of primary health care. And this is really to targeted at zero dose children, so children who have never received a vaccine before, and this is part of our equity goals, and to reach underserved communities. We also have a lot of work that is done in water and sanitation, in health facilities and communities as well. And just some work that we've done. The cold chain equipment optimization platform is basically renewing critical cold chain gaps in developing countries, and it represents about 51 countries, and we've, by the end of 2021, would have deployed 75,000 units of cold chain equipment at the last mile, and 57% of that is solar equipment. We also have the Solar Hub, which is essentially a knowledge resource and base for the WASH community, and there are a lot of expertise and resources available, and this we want to extend to the solarization of health facilities as well. So in terms of our vision for sustainable energy uptake, we want to leverage our knowledge in the health sector in terms of facility identification, understanding what services and the facility will be rendering, and therefore what equipment it needs and the demands. We are a procurement agent as well. We're the official procurement agent for the COVAX facility. So leveraging those expertise too, but then also some of the impact assessments in terms of the benefits for children, and then also playing in the policy environment as well. So in terms of a responsible waste management, we have been putting a lot of cold chain equipment and replacing obsolete equipment in country systems, and we need to make sure that this is decommissioned properly and disposed of safely. And also, so we have developed guidance, and we're supporting countries with that. The other thing that is of key focus to us, particularly with COVID-19 vaccine rollout, but also with COVID measures with increased use of personal protective equipment, is medical waste management. So there's a lot of focus, technical support and assistance that has been given in this area. So just some concrete examples, and you can look at this on our website as well. We've made schools from recycled plastic, and this has social, economic benefits, education, solar power to pump water and store vaccines, local RUTF procurement, and then also biodegradable bags and education kits. So we're really playing across all sectors. So essentially, the thing I want to speak to you today about is a think tank that we want to start, or a think and act tank. And this is where we want to invest in social development and touch on a number of the SDGs. We see that social innovation increases stability, it triggers a constructive growth cycle, it attracts investment and decreases poverty, which is critical to a lot of the issues and the challenges that we are supporting governments with. So the scope of the think tank will bring together the public and private sector expertise to help define a learning agenda and generate and curate and apply state-of-the-art knowledge on developing solutions. And we're particularly focused on health facility, electrification, so solarization or other renewable energy sources, sustainable procurement and reduction of the carbon footprint, particularly of in-country supply chains, and then waste management as well. And we are developing a process where challenges meet solutions. And this is essentially one of identifying a problem, designing a hypothesis to be tested, operationalizing it in the field, bringing back feedback, and then developing a roadmap for scale. And that includes financing and business models as well. So the structure is one that brings national and global partners together, academia, as well as private sector, civil society organizations, governments, and so on. And we need to leverage all of these expertise. So my ask today is, please get involved. We know there are a lot of people with knowledge out there, and if you have research evidence, are a learning institution that has knowledge in these fields, if you're an innovator or in industry and can play a role in this area, if you have funding that's towards a specific country or area that you want to pilot some projects, and if you're a government, an implementer, and you have already tested some good solutions that you want to bring to the table and let us know about, so that we can offer these as solutions and scale them, let us know. I have my email address up there, and get involved. I think this is an exciting initiative, and we want to start I think the discussion's already started, but we want to put it together and start bringing ideas together, particularly for the low and middle income countries. Thank you. And this is just some additional resources that you can do as additional reading as well.
Wonderful presentation. Thank you very, very much, Michelle. Really interesting to see how you're addressing the cold chain gaps. Very apt and topical given the COVID situation and obviously the movement of vaccines around the world and into endemic settings. And super excited with this think tank call to arms. Wonderful. I really we'll bring that up in the Q&A that's about to start now. I wonder if if I could just ask all of the presenters to kindly come back. So firstly, thank you very, very much for an incredible journey, actually, through what sustainability is today from a corporate perspective, from the non-for-profit, from a procurement lens, all the way through to this think and tank call to arms. I do wonder, I hope maybe all of you will get together to form that think tank. It does seem there's a lot of dovetailing and a lot of fit there. So perhaps that's something we can discuss. And certainly from the audience, I'm sure you'll get some feedback to that, speaking to that call to arms. I said, so the Q&A, we're going to start the Q&A. We've got about 35 minutes, so I'm going to try and keep my questions kind of rapid, but try and also work the audience's questions that are coming through as we speak. There's been a lot of kudos, kind of clapping, and thank you for brilliant presentations, great presentations from the audience, as all of you have been giving your presentations. That's all in the chat box. Thank you to the audience for that. So we mentioned earlier at the beginning, policy frameworks that surround or affect supply chain. Pauline, you mentioned yourself that for the last 18 months, you've really seen a shift in terms of supply chain moving from where it was then to, for want of a better expression, a more heavy gravity zone. And far more prominent now. Certainly COVID would have made that very much more prominent, the impact of it, but to see it through sustainability being the thing that's giving it gravity is very, very interesting indeed. So, you know, you made that point earlier. One of the frameworks we wanted to kind of look at, obviously with the International Society for NTD, the WHO's roadmap to 2030 for NTD, the guidelines that they put out, ratified by member states of their World Health Assembly last year. They represent a consensus position and a very, how to put this, consultative journey, so everybody to have their input into that. When I say everybody, the wider global health community. So I dare say the shifts that they are recommending will have a lot of resonance to people working in supply chain within global health. So coming to the first shift, I wanted to ask you, in that report, in the WHO's roadmap, it says they're trying to get companies to get people to move from a measure of success based upon action, so units shipped, doses arrived in a country to the patient, those kind of measures, from an action-based measure into a more impact-based measure of success. How does it impact the community? So I want to address my first question to both Didier and Elizabeth. I'll start with Elizabeth first because of your impact framework slide that you showed. How do you see supply chain, the supply chain community addressing this shift, the move towards impact measure? Elizabeth.
Thank you, Cameron. Well, I think I mentioned a little bit in the presentation how each project may be different and maybe looking at what are the products or the services that are being impacted. Looking at it from an individual basis in terms of what the project is about, and then walking towards the impact and then summing it up in that manner versus just giving an overall measure for everything that you do has really helped us to go through the right path of measuring the impact that we are creating. And so I can walk you through again what we mentioned. For instance, if the project is looking at the products or particular products that we're looking at, we'll see how then we have moved from improving or increasing access of that particular product, and then walking through to look at the market share. And of course, we use evidence-based measures, and then seeing how we can calculate reaching out to the communities that are using that product. And this has really helped us to be able to put the right numbers in measuring the exact impact. And it's been easier because we're working at a very local level, and scaling it up would still require us to look at the individual path for each of the enterprises that we're working with. So that has really given us that sort of modality for measuring impact on our side.
Very interesting that you're putting the community first. And I suppose that's because of your local kind of, you're the interface there between the communities and the 27 Merck experts. So I definitely follow you on that. That's brilliant. Didier, you were about to say something, and I was about to ask you the same.
Yeah, I just wanted to add that this impact points was taken into account from the very beginning when we discussed with the Mentee companies, you know, looking at all their improvement opportunities that they have, and then on which to focus on first. And then when we discussed and we listed all these elements, then we, of course, focused on the first priority where the impact could be the highest, definitely. And then we saw in the result also that they were amazing and very tangible. When you see that you have a service level that increased by 10% or 10 points of percentage, this is amazing. And when you see also that your procurement lead time is reduced by 2, it's amazing too. So definitely the important point is to look at that from the very beginning before starting the project and to go for it.
That's a fantastic point in terms of the planning of all of this and making that at the heart of everything. And certainly the figures that you mentioned, a 40% reduction in the delivery times, those amazing stats that you were showing really do speak to that working. So that's a fantastic thing. Turning to Michelle for a second, the same question. You mentioned climate change measures of impact. I wonder if you want to just elaborate that a little, to using that as a measure of success.
Well, first, I'll just going back to the initial question. Looking at when we're looking particularly in the immunization program, we look at the immunization agenda 2030 and full stock availability at the health facility level is critical. And when it comes to that, so access is, as Elizabeth had mentioned, is critical. And then when it comes to temperature sensitive pharmaceuticals as well, potency is another dimension that needs to be added to that as well. So I mean, I think there are sort of two dimensions there. Then when we look at climate change, I mean, in terms of measuring impact, I think I'm not a climate expert or energy expert. I mean, my expertise are in immunization supply chain. So, I mean, we look at, the measures that we can take from a sustainability point of view that are not damaging to the environment. So implementation of anything that, through the supply chain, when we procuring cold chain equipment, ensuring that it's CFC free and not emitting harmful gases or harmful emissions to the environment, and then also making sure that it's energy efficient as well, thereby reducing the carbon footprint. So those are the measures that we look at, and obviously not just within UNICEF's own supply chain, because we're working with governments, and the end goal is to ensure that the child, the mother, those communities gets the medication and the health commodities that they need, at that very last service delivery level. So I mean, it's throughout the supply chains of governments, partners, etc. that we look to support.
Mm-hmm. That's a very interesting answer. This kind of development of proxy measures in terms of not just a straight healthcare kind of measure, but this climate change. What other measures? How about you, Pauline? In terms of you put sustainability through procurement. What kind of measures would you look to? Are Officio working on? Are you working on anything of that nature in your work?
It's a great question, and I definitely echo Michelle's sentiments. One of the interesting things about sustainability and procurement is some things are much easier to quantify than others. So things like pollution and carbon footprint are imminently measurable. Things like biodiversity loss or the in-country level of natural capital. There are plenty of smart people who are working on that, but that's not something you can just take and write down and say, have I ticked the box on that? So I would definitely agree. I think what we tend to focus on is the things that are best understood now, acknowledging that they're not perfect, but it's a step in the right direction. So things like carbon emissions per product, per mile, per supplier, looking at both, again, they're kind of scope 1, scope 2, internal carbon footprint, but also the scope of their entire supply chain. The other one to add, which is not sort of directly related to climate change, but I think very relevant for especially when we think about medical supply chains, is waste. So looking at plastic use and waste streams is increasingly coming into focus. And I think we're seeing some good developments in things like chemicals recycling that just weren't really at the forefront 5-10 years ago. But now that there's this focus on establishing that circular economy and people are measuring themselves and reporting on it, it's kind of building the need in the marketplace for increasing that.
That's a very interesting point. And it does kind of make you feel the added gravity of supply chain right now, because just by asking that one question, we're kind of tripping into the SDGs, really, in terms of those kind of opening up those and those impact and those touch points onto supply chain. We will come to that framework in a second or two, but that's a very interesting point that you've made there, Pauline. Coming to the second in the WHO roadmap, they are talking about moving from a disease-specific vertical approach to a far more multi-sectorial, multidisciplinary, horizontal, partnership-driven, I guess that would be the way, position. And we've had some audience interaction as well, which I'm going to read out to you before I come to asking you about that. Dr. Stephen Bramia from Canada, from entomologist from there, he works his own consultancy in vector control in Canada, is asking, is it possible to collaborate with other pharmaceutical giants to facilitate and have a more effective and broad-based impact? To which someone else in the audience, Margot Carlin, one of the directors at Business for Health Solutions, is saying BHS works with a number of corporate partners. We're always looking to broaden our consortium and bring in new partners, both pharma and other healthcare. I suppose I said there's kind of a bit of chat going on between the audience. What I wanted to do was ask you guys, what does partnership mean to you? We're being asked by the WHO's guidelines to move from this disease-specific silo into a far more connected world outside of that particular disease setting, as it were. I'd like to ask that to Elizabeth first, because you're at the front end of it. You are connecting people. I love that model that you showed us, the connect, the whole, that your 4-step model, getting people and putting them in touch with the not just that, but much more than that, interfacing them with the experts at Merck. So what does that mean to you when people say multi-sectorial partnership building, multidisciplinary? What's your definition of that? To Elizabeth,
yes,
please.
So definitely for us, partnership has a weight in influencing the overall increase in access to healthcare. And when we mentioned, if you saw in the slides, we really look at creating partnerships with all enterprises across the healthcare value chain. And so we do not isolate a specific focus. And we are also most of the time not even, although at the end of the impact, we look at the overall disease that we have created an impact in, but we really look at the whole chain, who is involved, because it's so multifaceted. And without collaboration and coordination, you would not likely reach that impact that Michelle has been talking about, or Pauline has been talking about. The sustainability would crumble. So the value of partnership has really been demonstrated, although we have started in a smaller scale through our projects, that if you really reach out to others with the right expertise, you can really improve the efficiency and effectiveness of increasing and improving the access to healthcare overall. And so it's a cornerstone. It's a cornerstone for creating change for us through the BHS model.
Yeah, that's a fantastic answer, Elizabeth, really. And I think that sums up where we are in terms of the de-risking progress through partnership. Is one of our actual mottos here at the ISNTD, progress through partnership. So I think it's a fantastic answer that you've put. It's so important. It's in every touchstone. You use the word. Absolutely agree with you. I'd like to ask that question to Pauline, please. If you before I go to the think tank, I think we may have lost Didier. I'm not sure. He seems to have disappeared from the screen. But Didier, if you are watching, you can just click the link and you'll come back into the room, refresh your page perhaps, or just click the link and you'll come back in. I'm not sure we've you, how we've lost you, but it's all fine on our end. So perhaps refresh your browser or just click and you'll be able to join us for the discussion. So I wanted to ask this to you, Pauline. You mentioned in your slide deck the work you're doing at the government level. Also, the reticence, the resistance, rather, the reticence towards partnership or sustainability as the kind of thing that's driving catalyst for multi-sectorial partnership, and then resistance to the sustainability part coming from senior management within companies. How do you look at tackling that if you are trying to develop further partnership channels? How do you tackle that resistance at senior level in an organization? As a consultancy?
Absolutely. So I think from our experience, without sounding too cynical, I think that the most effective way that change is made on any topic is there's some form of commercial backing. And I think that that's really a challenge for all of us to take forward, is when we're looking at how do we drive innovation, how do we drive sustainability into our supply chains. I think that where organizations tend to struggle is if they naively think that by wanting to do it, we can do it. You really do need to build some, and again, that doesn't need to be based around cost. So when I think of the benefits of partnership, usually there's a couple of ways that that's done most effectively, certainly from what we've seen. So the first is around upskilling, and often that's a level of mutual benefit. So your organization will have specialist expertise in X, ours will have specialist expertise in Y, and being able to compare between the two to upskill there. Second is around kind of investment. So where it is tougher to make a financial business case, often by joining forces, even within the same industry, but cross-industry, can kind of limit that commercial risk to your organization. And where we're seeing these kind of government mandates or organizational pressures to do that makes that easier. So we want an in-country infrastructure for higher levels of renewable energy, for example, or we want a chemical production facility locally. That can't happen overnight. So what do we need to do as various members of the supply chain to drive that? And then also any form of kind of innovation. Can you put your research and development dollars behind something that is probably a longer term economic gain, but we'll get the ball rolling because you know that that's something that will be required down the line. So I think, yeah, from certainly what we're seeing, and again, the Middle East has been given a really explicit mandate. And I think that the reason it sticks in my mind as a good example is there's few governments who are at that level of mandate yet, but I think it's coming. I think in 2025 or 2030, increasing governments across North America and Europe and Asia are starting to make those signals around climate reporting and plastic use and things like that. So even if it's not mandated now, there's something to be said about if it doesn't make sense commercially for your quarterly business report in 3 months, it probably will make financial sense 2, 3, 5 years down the line. So bearing that in mind and being able to articulate that is really critical.
I think it's a fascinating additional momentum and additional gravity to supply chain, that this could be the door through which these multi-sectorial partnerships end up actually happening. Michelle, I'm going to ask you the same question. In terms of your think tank, you're obviously thinking about multi-sectorial partnerships and there's an active call to arms there. What's your ideal blend there? What was the thinking behind that, and what's your ideal blend?
Well, I mean, I think
Michelle.
Sure. I think the ideal blend is leveraging the private sector and where a lot of the innovation does come from, along with the implementers who are essentially governments and countries, and we often represent that. In terms of our programs and the boots on the ground in terms of doing that, and then of course we need academia and academic institutions as well to come with a knowledge base evidence, research, etc., and bringing those together along with funders, donors, etc., that have a vested interest in ensuring that this comes out. But at the bottom line is that we need to have address everyone's have a value proposition that addresses everyone's needs. So what is in it for what are the funders going to see, what is the benefits for them? Are we addressing the needs that they need, their priorities? Are the government's needs addressed, and they're not just getting innovations pushed on them that they don't need, but that are truly going to have an impact on their environment, on their health programs, and on their supply chains from a sustainability point of view. And then industry as well. I mean, they also have a vested interest too. And there is in non-profit sector, there is sort of this perception that it's a sin to make a profit. It's not, because that is where a lot of the innovation and the R&D budgets have to come from somewhere. We do understand that. So I mean, those things need to happen as well. So I mean, I think just bringing those things all together is incredibly important, and I think that everyone has a role to play.
That's a fantastic answer. Given that you have got a call to arms out to form a multi-partnership kind of think tank, as you've described, that brings me neatly to Didier. Didier, I guess you are in the hot seat when it comes to partnerships as the corporate hot seat. I would love to see a Merck and UNICEF partnership on that basis, frankly, in supply chain. But what's your view on that? Do you see, from your corporate perspective, do you see these kind of partnerships more on that kind of axis towards civil society in terms of the I don't know how to put this, where do you see that axis developing with other corporates? The question that was asked by the member of the audience, Dr. Stephen Bramia, earlier was, is it possible to collaborate with other pharmaceutical giants to facilitate and have a more effective and broad-based impact?
So my answer would be definitely yes, and I can give you a very concrete example because we co-founded a few years ago what we call the accessibility platform. That was a unique platform, industry-led initiative where we had representation from global health and supply chain. And then we had more than 10 industry partners, the pharma companies working together with other external stakeholders, NGOs and so on. And the objective was to raise awareness and addressing the supply chain and delivery issues, and especially to tackle that into the access to health challenge. So through this initiative, I would say, we had quite a lot of different concrete projects. Training some people in Africa was an example, and also collaborating with other pharma companies, other NGOs, and local entities, I would say. So definitely yes. And as I said, there was no issue having many different pharma companies together, even if they were competitors, working together on that aspect.
There's a mutual goal and a kind of understanding between them. Well, that's a fantastic answer and very inspiring answer, frankly. And I suppose at this point, it's almost a circular conversation because we're going to kind of come back to your access to the mentorship program that you both highlighted earlier in this last question, I suppose, because the last of those shifts at the WHO roadmap level is all they're talking about country ownership, the move from an external-led expertise to a more country ownership model, sovereign-owned model of that disease, the programs associated to it, the various nuances, including supply chain within that. And so their aim within that shift is to galvanize political will in that country to fight that disease, and at the same time leverage potentially investment capital. You mentioned in quite a few of the presentations capital, the requirement to invest, the investment capital that's latent in some of these countries. So the shift that they want is a country ownership model to start forming. At the very heart of that model, if you think about it, to galvanize political will, you need the local voice to be heard. And I suppose a road to that voice being heard is education and training. So I wanted to ask this question to Elizabeth, who, as I said earlier, literally, as we've heard, is right at the kind of interface level between bringing people into this mentorship program, as well as all the other stuff that BHS are doing. So I wanted to ask you, what's your view on that? How are you seeing that from your kind of grassroots? You're there, you know, how's that work for you, this shift? Elizabeth.
Yes. Thank you, Cameron. Well, definitely we have been very excited over the last year and a half to see how locally people themselves who want to take a step further and couldn't even imagine having access to international knowledge and modalities of operation have now been able to be linked with global corporates who have been doing this in a global scale. And that really helps us to create our own ownership here locally. And the model doesn't have to be the same for all. It can be different. An industry or an enterprise itself can adopt the modality to ensure that what they're doing is really enabling them to reach a wider community and also creating the impact at the end of the day. And so that creates ownership starting from the enterprise level and impacting the private health sector, which we've been really trying to uplift, because this is an area which has been slightly neglected. But for instance, in Tanzania, the private health sector caters for 1/3 of all healthcare needs. And this is a significant amount. And so putting energy into allowing them to create models of operation that can reach out and access information at a global scale virtually, it's been amazing. And of course, we've mentioned a little bit about the training that comes into this, but being able to do this physically would have been really a challenge and quite costly. So adopting the virtual method, that has been really escalated, unfortunately, because of COVID, but people have become a bit more aware of the value of virtual trainings and how effective that can work as well, has really made the world a little bit smaller. And we really are grateful to have the platform, and internet access has been amazing. Last time you saw us in the middle of nowhere, but there is still really good internet access.
Wildlife documentary,
yes,
it was, yeah.
Absolutely. And so the reach has really spread across, and so we do see a lot more uprise from the different enterprises that we're working with privately. Thank you.
That's a fantastic answer from someone in field, engaged in that, and a very inspirational kind of look at your mentorship program. Didier, as one of the 27 mentors at Merck, I'm assuming you're one of them. I'm sure you're one of them. What's your this kind of engagement on the road to developing country ownership, using the local kind of engagements through this BHS program, the mentorship? What's your view on that?
When you are in a headquarter, when you are in a headquarter and in a pharma company, you would like to help, but you don't know how. And that was the case for most of our volunteers, because they didn't know. They wanted to help, but which mean? And thanks to the collaboration with BHS, then we had a connections with the companies or the distributors in Africa. And then everybody was very happy, because that was quite easy. As mentioned, it was a remote session, and we could see that through a few hours of discussion or review all together, we could get a lot of benefits. So very positive for the people who participated from the Merck side also. And what was great is that it was really starting from the need from the market, and then we worked on the initiatives and on the projects on that.
That's a great answer, Didier. A win-win. Basically, everybody is going to get something from this, not just a kudos, but genuinely, it's a real win-win. So I think that's a wonderful answer, and I applaud you both for those both great answers. You're working right in that, so I wanted to hear that from you. Pauline, I'd like to push that to you in terms of from a consultancy perspective, and you're working with these governments of Saudi and the Middle East, and how do you see country ownership developing and the role of supply chain within that?
Yeah, it's a great question. I think, again, I'm of the belief that the trend is going towards increased localization. I think that the global supply chains we've built are fantastic and will not go away by any stretch of the imagination. But there's been a significant push. It's true in the UK. It's true in several parts of North America. It's true in several countries, specifically in Africa, that they're pushing for that, and then especially in the Middle East. And the reason for that is a couple of things. One is to kind of drive the Sustainable Development Goals around employment and balanced income, balanced diversity. By creating local job opportunities, it opens a lot of those windows. The other thing is around, keeping your supply chain local can have some sustainability benefits in terms of carbon footprint as well, right? If you're not traveling halfway around the world to develop some of your goods and services. And the other link to that, I guess, is around as technology develops, not just in terms of communications, but also in terms of production. So I've seen some really interesting pushes around, additive manufacturing. Why would you ship a part from one continent to another when you could just make it locally now? So I think that there's some quite strict top-down regulatory pushes, and then the rest is kind of seeing this as an opportunity to grow and improve. And I think those two things are going to come increasingly dovetail together over the next decade is my prediction.
Yeah, that's fascinating as an answer. Thank you for that, Pauline. And I know Lisa O'Halloran's been asking within from Officio and posting some very interesting links to your work. She's asking about new technologies in the SDGs, which I'll try and come to in a second or two. So thank you for that, Lisa, as well. And thank you, Pauline, for that answer. Michelle, in terms of your viewpoint on this country ownership, for me, it's very interesting, UNICEF's position, because you're very much working with the youth in countries. You've got this mother-child, you've got this kind of, there's not a bias, but there's a pivot within your landscape of engagement. So I wanted to ask you, what's your view on developing country ownership, UNICEF supply division, UNICEF supply chain, and this particular area of,
I mean, we've seen traditionally in our programs, I mean, without country ownership, there's complete failure of a program. So it is completely critical that there is buy-in. I mean, we're there to strengthen government systems, country systems. So it is important that there is that buy-in at every level of the system as well. I mean, I'm speaking particularly government systems, but also in terms of the private sector as well locally. It is important that is developed and expanded upon as well. So that there is a good mix of public and private services within a country. And that is obviously, but I mean, we really do need to engage directly with governments on this. I mean, it's only in places where, where governments are not in control, etc., where we will deliver services directly and through other NGOs, etc., like the Yemen or etc., where those situations exist.
Yeah, that's it. That's a great answer. Thank you for that, Michelle. Very interesting. I wonder how much knowledge transfer is going to play a part in terms of bringing the kind of educational bridge to the local, bringing the local capacity up, driving capacity up through education. Lisa O'Halloran from Officio, what do you see as the main barriers to partnerships, working collaboration across sectors? What are the main barriers? Very, very quickly. What would be if you had to put barriers, what would be those barriers? Elizabeth, I'm going to go to you first.
Well,
From your viewpoint.
From our viewpoint, one of the barriers that exists is, of course, the cost aspect of interaction. That is a huge barrier that we have really tried to narrow down by supporting virtual methodologies of allowing people to reach and interact. And of course, regulations and policies that govern interactions in countries can really restrict interactions, especially across borders. Those are the two main areas, but also we do still see a barrier in terms of language and engagement. It may seem like a small issue, but when you are operating on a virtual aspect with different global personnel, it can be an issue if the message is not coming across. So also trying to be aware of that and creating a platform where people are able to understand what is being articulated and how to collaborate. And fourthly, which we are grateful is really improving, is the internet access, which has been a barrier for us for a little while, but we are amazed at the changes that have taken place in the last few years, especially in countries or with the countries that we've been working on. So those are sort of the main areas that we've faced challenges in, and I would mention those for now. Yeah.
Fantastic answer, Elizabeth. Thank you for that. Didier, you mentioned in your first mile, second mile, last mile, some of those challenges. Perhaps some of those are barriers. I mean, what would you say are the barriers to multi-sectorial or partnership or working collaboratively in a collaboration? I can't say that word, working collaboration across different sectors.
Yeah, with the example that we had with BHS, definitely more than a barrier is more a challenge in the fact that we need to ensure that we have a good match between the need and also the expertise that we have. The legal aspect is also to be taken into account. It's never from one day to the other that you can go through a project like that. So you need also to ensure that legally everything is signed and ready. You mentioned, Elizabeth, the network. This is right. At the very beginning, we had a lot of issues on that. And then we lost a lot of time due to the network issue. And then having a remote session, if you don't have the network, that's for sure that's a big issue. So these are the main ones. Otherwise, more than barrier, they are more just challenges, but there are no big ones that cannot be overcome. No problem.
Yeah. Brilliant. Thank you for the answer. I know your answer is going to come to integrate at some level because you are actually doing this. You're working together, BHS and Merck. So
yes.
There's a great answer there. But I understand how that integrates. So thank you very much for that. Pauline, very briefly in terms of challenges towards working in collaboration from a consultancy perspective.
I think it's not an active barrier. It's just something that's happening, is lack of awareness. It's not that people don't want to collaborate or look to other industries. They just haven't. So I think that's something that's really important to bear in mind as well. It's important to be vocal about this. It's important to actively seek rather than assume it will come to you. There's some, especially within sectors, some really fantastic things. I don't know if people have heard of the Together for Sustainability initiative that's to do with the chemical sector, or Thomas Edison has founded what's called the Sustainable Procurement Pledge, which is just an open platform of free resources available for sustainability and procurement. That's all out there. There's nothing preventing people from kind of learning and getting involved cross-industry. It's just if you don't know, you don't know. So I think that's an interesting point, is again, more than ever, now is the time to kind of keep your ears and eyes open for opportunities to learn from other industries.
Fantastic. And there does seem to be so much going on, all these various touch points, as you all described, within supply chain, that absolutely, and I see a lot of links that have been posted by BHS, by Merck, by Officio, the UNICEF links that Michelle, you showed as well. So I'm sure that speaks volumes to that. Michelle, you have the final say on this. You had a call to arms. Have you anticipated any challenges in terms of getting these people into the potential, partners into a think tank situation?
So I think some of the challenges that we foresee is obviously addressing the various vested interests of different parties, and trying to unite in one goal or towards one goal. I think that is always a challenge with anything. And sometimes always when you're bringing different parties together that haven't worked together before, there's also that lack of trust, and that needs to be built up as well. Yeah. So I foresee those as being some of the critical challenges. Once those working relationships are established and that trust is built, and we understand what we're working towards, and everyone has a vested interest in achieving the same goal, I think we can move forward very, very easily.
Fantastic answer. Thank you for that, Michelle. We have got a lot of other questions. I don't think we're going to have time to ask, but what I am going to do is definitely, you're getting a lot of claps, Jennifer Giovanali from some great presentations. Thank you very, very much. Margot Carlin, one of the senior directors at BHS, has given her email for people to kind of get in touch. And I'm sure a lot of people will be getting in touch with you. Carolina Batista from Brazil, she's one of the board members at Médecins Sans Frontières, MSF, and as well as that on Baraka Finance. I'd like to give a massive round of applause to everybody on this panel: Elizabeth, Didier, Pauline, and Michelle. Thank you very, very much from all of us. And I really hope this translates into meaningful partnership and meaningful collaboration for you in all of your different perspectives. And I truly hope this is the embryonics of the UNICEF think tank. If I'm honest with you, I hope there's so much synergy between everything that everybody's talking about, that I just do hope it works out for you all. Thank you very, very much for joining us.
Bye, everyone.
Saying thank you.
Thank you.
Bye-bye.
Thank you, everyone.
Thank you.
Thank you a lot, guys. All right, take care.